Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today is a returning guest to the show. She is Susan Dubb. She is a public health nurse for the Uncas Health District. Welcome back to the show, first of all.
Good to be back, Sean.
It is that time of year, or I guess this is a good time for us to be talking about, kind of keeping an eye on your health, the public health, and what the Uncas Health District does. So let's start with the basic definition of the health district. What is that?
Well, I actually wrote it down, Sean.
We're over the glasses for this. That's how important it is.
Pulling out the glasses. So the Uncas Health District was created in 1988, and it is an unincorporated, unaffiliated, nonprofit agency that operates under the Connecticut General Statutes. We currently serve as the local health department for 9 towns, and I can list them alphabetically: Bosra, Griswold, Lebanon, Lisbon, Montville, Norwich, Salem, Sprague, and Voluntown. And that serves about 95,000 residents. So we're busy.
Yeah. And so one of the things people might be familiar with what you do as the health department is you may go into businesses, restaurants, and that sort of thing, and just kind of, make sure everything is kosher, everybody's up to code, everything is healthy, and everybody's happy and not sick, right?
Exactly. And, we kind of look at it in 2 aspects. We kind of have the community health side, which is more the side that I stay on, and then we have the environmental health side. But we always cross over with each other. I look after childhood lead management, I look after TB, I look after asthma, any kind of health issues. And then sometimes health issues happen as a result of environmental issues, like it could be bed bugs, it could be cockroaches, it could be something mold in the home. And then I collaborate with the sanitarians and we kind of come up with a plan together. So, the environmental side, they take care of the food services, they help people with septic inspections, failure of septic systems, how to get it repaired, those kinds of things. If they're building a new addition on their home, is their septic system going to be large enough to manage the addition on the home, or are they going to have to enlarge their system a little bit? So we work separately, but we work together as well.
On the residential side, how often would you go to a person's home, whether they own the home or maybe they're a tenant, they rent the home or something like that? Do you need to be alerted or called before you go in, or is it like a regular yearly thing that you would automatically go in? How does that work?
From my side, it's typically initiated because that there's I get a call that there's a child with an elevated lead level.
Okay.
It could be that I get a call. One of the things that I do quite frequently, actually, is I get packages from the TB Immigrant Health Services at the Connecticut DPH. And these are individuals that are coming into the country who need to be screened for TB because they're coming from areas of the world where TB is much more problematic. So I typically go out and visit those folks, and I help coordinate an appointment for them to get screened at the infectious disease clinic, and then that paperwork is sent back up to the state, and they're able to continue on with their immigration process.
So is that before they even come into the country?
No, they're typically here, and they
but there's a certain
notified.
time period where they have to get to you to take care of all that stuff? Okay.
Yeah.
Otherwise, they get the boot. Because
the immigration folks notify our state health department, and then the state health department sends out the paperwork to me, and then I help facilitate the appointment.
So every year, there's always a hot button issue, topic, health concern or scare that's prevalent in the news. What is it that people are concerned about this year?
Well, I think certainly at the beginning of the year, we heard an awful lot about Zika virus.
Yes.
It seems, or it would seem, that the newsworthiness of it has kind of died off a little bit. That doesn't mean that it's gone away. It's still very much alive, in the Caribbean, South America, Puerto Rico. It's becoming much more of a problem. It's even kind of crept onto the shores of the southeast United States in Florida. So the concern is for people who are traveling down south, if you're traveling to an area where Zika virus is known to exist, then we need to make sure that people understand how to keep themselves safe. Mosquito repellent, wearing long sleeves, not being out around dusk or dawn, and as long as they're kind of following those general guidelines, typically.
So there isn't a vaccine per se that you can take
Not yet.
before you go down.
No, they're certainly working on some vaccines, and we're hoping that that process is going to go pretty quickly. Certainly, vaccine technologies have improved over the years. We're not left to just making vaccines in eggshells that take 6 to 8 months sometimes to develop. There's new technologies that move a lot faster and can produce higher volumes. It's not dependent on the fragility of eggshells, if you will.
Isn't that still the process with the typical flu shot, though?
It has been for the bulk of the vaccines, but there are a couple of different ones. Flu Block, which you may have heard of, is a vaccine that's available now for people that have egg allergies. And it is what's called a recombinant vaccine. So it is actually done entirely through a chemical process. They don't actually use live egg mediation or anything like that. And then there's also cell-mediated vaccine, where actually the vaccine you're going to get today.
I am getting a flu shot today.
Yes.
And somehow she'll have to distract me so I don't, act like my typical baby self. But
that is actually mediated in dog cells, dog kidney cells. And so it's a little bit, it's not quite 100% considered egg-free like Flu Block is, but for someone who might have a mild allergy to eggs, it's a better choice.
But dog kidney cells? So they incubate them in that? Wow. Are the dogs alive, or how do you do that? Okay, all right.
No.
So it's just cultivated and then
yes.
and done that way. Okay. Whew. Now I want to get back to the Zika virus for 1 second, because the thing that the people were most concerned about, the biggest health risk was a pregnant woman, correct?
Yes, absolutely. At first, when the reports came out about microcephaly and Guillain-Barré syndrome as being effects of the Zika virus in the newborn child, there was a lot of attention given to that. And certainly in the beginning, it seemed to be pretty obvious that one was causing the other, but we have a saying in science that, coincidence doesn't necessarily mean causation.
Right.
So we are now have scientific proof that yes, indeed, there is a link between the two. So for pregnant women, if they don't have to travel to those areas, it's just safer not to.
Yeah.
The risk of you getting a bite and putting your pregnancy in jeopardy.
Boy, mosquitoes are just, they carry everything, don't they?
They
everything,
do.
West Nile, everything you can think of that's bad,
Yep.
a lot of times a mosquito is carrying it. What is it about that particular creature?
I just think that, it's out everywhere.
Yes.
And they kind of,
Very annoying too, by the way.
the things that you can do to actually reduce the numbers of mosquitoes are, making sure that you don't have things in your yard that have standing water in them. If you
Right.
have old tires or flower pots or things like that, turn them upside down. So, not that you can turn a tire upside down and make a difference, but get rid of the tires.
Right.
But the flower pots, even a snow shovel just sitting on the deck can collect water, and the mosquitoes love to breed in that area. So, tipping things over so that water can't collect, you're removing their breeding area.
Gotcha. I want to save the flu stuff for the second segment when you're
Absolutely.
jabbing me with your needle. So let's talk about some other things. As we tape this show, we are officially in the holiday season. So someone from my staff was concerned about things like foodborne illnesses around the holidays, because there's so much food being served, which means so much left out, so much thrown in the fridge. Talk about that a little bit.
Absolutely. Very timely, because we have our MRC unit, Medical Reserve Corps unit in Uncas Health District. We actually produce now a monthly newsletter, and I was asked to write an article about holiday food safety. Certainly, you know, the turkey, the ham, the sweet potatoes, the stuffing, all of those things, they're wonderful the day they come out on the table.
There's no leftovers at my house, by the way, but go on.
Yeah,
Clearing it out.
I kind of have the same thing
Yeah.
happen at my place, but when you serve your side dishes, the goal is to keep hot foods hot and cold foods cold. Because if you get into the danger zone, which is somewhere in between hot and cold, that's when the foodborne illnesses start to take hold. So the key is, if you're going to have your stuff out on the table, make sure that it's not out any more than 3 to 4 hours. And that's kind of pushing it. I mean, most people are finished before that. But the key is to get up from the table and put the leftovers away. Package them up properly.
Key.
You know, you don't want to have your turkey or ham, whatever you have for Thanksgiving, on top of containers of your leftovers, because if there's any juices that drip down, they can contaminate your leftovers. So making sure that your leftovers are in well-sealed containers to kind of prevent that from happening, but the drippings can still get down on the lids of the containers. So you want to keep your containers up top, keep your turkey and your meats down below.
It's real easy for someone to get done with their plate and head to the living room and plop down on the couch.
It is.
That's what you really want to do, but be smart.
You know, for the overachieving cooks who really feel like they need to feed an army of 20 or 25 when there's only 5 people show up.
So true.
You have so many leftovers
Right.
that the tendency is day after day after day.
Oh, yeah, a lot of sandwiches, turkey sandwiches, all that. Yeah.
So if you're really meticulous about taking your stuff out, using just what you want, and putting it right away, heating your leftovers to the correct temperature, which should be 165 degrees Fahrenheit, and most people can get a regular food thermometer at any kitchen. I think they sell them at the grocery stores even, just to make sure that your leftovers are heated up to the proper temperature. That is what will help keep you safe. Best rule of thumb is to not keep any leftovers past 5 days.
No problem here,
because
but
that's
other houses,
really pushing the limits. Because most people, I know my husband, when he makes a sandwich, the stuff is usually left out because he may come back for a second. So rather than putting it right back in the fridge, it's stayed out a little longer than it should. So
even I know to put the milk back even if I'm going to have a second bowl of cereal. Milk back in the fridge, only because I think like I want it nice and cold, but there's also a healthy reason to put it back in there too.
Exactly.
You know?
I mean, you want to avoid things like salmonella, campylobacter, listeriosis. Those are things that can occur. Those are salmonella and campylobacter are probably the 2 most common that I get reports for, and I probably get a couple a month.
And it could so easily be prevented by, proper wiping down and disinfecting the...
Absolutely, disinfecting your surfaces, not using your cutting board that you use for your meats, for your vegetables, because then there's cross-contamination. Hand washing is the #1 way to prevent spread of infection. So making sure you wash your hands after you handle the meats, before you handle the other foods. That's probably the most important thing you can do.
I want to go in another direction now. We're going to go along in this segment. I want to talk about lead, because that's an issue of yours, a concern of yours.
Absolutely.
Especially in older premises, I guess. So let's talk about that a little bit.
Sure. Anyone that lives in a home that was built prior to 1978, there's a pretty good chance that there's probably lead paint in there, especially if there's original woodwork in the home. Norwich and a lot of the surrounding towns have usually sections of the town where you have older homes, and they've now been converted to multiple apartments. It used to be a single family at one time in its heyday, but now you have 3 or 4 apartments made out of this one building, but it's still the original building. So if we have the paint starting to chip, the paint chips actually break into a very fine powdery dust, and it kind of settles on the floors. It can settle in the window sills, anywhere where there's a friction surface, like a door opening and closing. You're opening your windows and shutting them. Every time that you're taking that action, you're creating more dust. And little kids especially, the ones that, from about 1 to 3 years old, they're down on the floor. They're crawling around, everything in the mouth. So these are the kids that are most at risk for exposure, and that's why in Connecticut we have to test our children by statute twice by the time they're 2 years old. So typically what happens is we test at their first year physical and at their second year physical. And what we're going for is obviously no lead
Right.
in their blood, but anything under 5 is considered acceptable. I have, as of this morning, 61 cases that I'm managing right now in our health district of children that have lead levels higher than 5.
Is that just a matter of a lot of older premises in your districts? Is that how it's working? Or?
It's not just in our
No.
district, it's throughout
Oh,
the
boy.
state.
Yeah.
It really is. And especially in the larger urban centers, you know, the Bridgeport
Yes.
and New Haven and Stamford and those areas that.
Right. The bigger the city, the more the older buildings are
Exactly.
going to be, which hence means more lead. So.
Exactly.
All right.
So it's, you know, it's about getting out there and doing education. We go out to a lot of the preschools, do some screenings out there. I can do a simple screening in the office for no charge. It's a little finger poke. I have what we call my, excuse me, my magic straw
Yeah.
that pulls up a little sample, and within 3 minutes I can have a screening level. If it's above 5, then we would send the child on for a blood test in the arm, which is a confirmation level.
Right. And then what do you do if it is above 5%? There's steps that can be taken.
Every test that I do, irregardless of whether it's 5 or lower or 5 or higher, I have to report them to the state of Connecticut.
Okay, gotcha. All right. Well, we're going to take a break and come back, and when we do, I'm going to get stabbed in the arm. Or actually just a flu shot, but it's dramatic teasing that makes you want to come back. So stay with us. I'm Sean Murphy. This is For the Record. We'll be right back. Welcome back to For the Record. I'm Sean Murphy. Susan Dubb is a public health nurse for the Uncas Health District. We have learned a lot today, and we've got more to get to, including my flu shot, which will be coming up momentarily here. And Susan has also given me this wonderful distraction, so I won't even know I'm getting a flu shot because I'll be looking at this, enjoying this funny toy. So as you're giving me this flu shot, let's start with the misconceptions that always seem to take place with the flu shot about, oh, it'll get you sick, oh, it's going to
Yeah.
cause deformities with humanity for the rest of existence
Yeah.
and things like that.
There's a lot of falsehoods out there. I will say the most common one is that people are going to get sick if they get the flu shot. And the fact is the flu vaccine that I'm giving you today is actually not a live virus. So it can't get you sick. What happens typically is that it takes about 10 to 14 days for the vaccine to be fully effective. So if you want to look at the airplane.
Okay, I'm looking because I don't know if there's a shot coming or not, but I sure can feel one.
There it is.
Oh.
You're all done.
Oh,
And
this didn't work at all.
well, let's make sure you got a Band-Aid
Okay.
just to show it as a badge of honor there.
So now, how long does it take for this
So-
to actually take effect?
So 10 to 14 days before it's fully effective.
So if you happen to get sick between now and then, you may have been getting sick before you got the flu shot.
Absolutely.
And people will blame the flu shot on that.
And the other thing that people don't realize is that you can actually be contagious with the flu for 48 to 72 hours and not be showing any symptoms. So you could have run into somebody at the grocery store or out doing Christmas shopping that had the flu and didn't even know it. And so your vaccine is only minutes old.
Right.
Even if you went shopping tonight and you ran into somebody,
Right.
you could get exposed and they think, oh, automatically
Because
it
this
was the
hasn't
shot.
taken to an effect. This hasn't gone into effect yet.
Exactly.
Right.
Full 10 to 14 days before it's fully effective.
Everybody
So,
blames the flu shot for when something bad happens, right?
exactly.
Now, every year, there always seems to be like what they would describe as like a different strain that's going through, and they try to do their best to get the immunization to those what they think that are most vigilant. Correct? Is that how it works?
Yes. There's actually a committee that meets every year, a group of very brilliant people. And while, yes, there is an element of guess to it, these are really smart people that guess.
Do they usually hit the mark for the most part?
For the most part, they get it pretty good.
Yeah.
The flu shot that I just gave you today has 2 strains of A and 2 strains of B, so that's maximum protection for the season. It's what we call a quadrivalent vaccine. Previously, there was a trivalent, which had 2 strains of A and 1 strain of B. And the reason that there's 2 strains of A in every vaccine is because the A vaccine, or the A virus, is typically the one that makes people sickest. That's the one that we typically see at the beginning of flu season, and then it kind of transitions over to B in the second half of the season. So
When is flu season technically?
flu season typically runs from about the beginning of October until about the end of March.
Okay.
And it kind of moves depending on what part of the country you're in. Here in New London County, we typically see the flu roll in about mid-January, sometimes a little later, sometimes a little earlier. So we try to make sure that people don't get their flu shot too early, but we also don't want to get it too late in case we have an early flu season.
Right.
So
Is getting it once a year, is that one of the most effective ways? Like if you didn't, how long does it last, the effectiveness of a flu shot?
the effectiveness is the maximum effectiveness of it typically is about 6 months.
Oh, okay.
But it does have some protective qualities to it for up to a year, which is why every year we encourage people to go back and get the annual flu shot because A, the strain may have changed, and B, just the routine of getting it every year provides another added layer of protection.
And people should realize, like you had mentioned, what it is it's a dead virus. So you can't get sick from it, but your immune system can identify it and mark it. And if the
Yes.
real virus comes along, then it knows what it is and it will destroy it.
Right.
Correct?
And the only time that we would be in an odd situation is if you have a virus that shows up that's never been around before, like happened in 2009 when we had the H1N1 virus,
Right.
a pandemic or a novel virus where nobody's ever been exposed to it. Therefore, you have a large number of people getting sick, and it takes a while to ramp up the vaccine to be able to protect people from it.
So number one preventative thing you could do to not get sick in general would be wash your hands. Wash your
Yes.
hands, wash your hands.
And when you think you've washed them enough, wash them one more time.
Now, what is your thought on like the antibacterial soaps and things like that, or Purell, things like that?
Well, you know, there's certainly been some discussion at the CDC recently about the need to do some more studies now about hand sanitizers because they've been out for quite some time and there really haven't been any studies done in a while. So I think that they're going to be looking a little more closely at that, certainly in the next couple of years, to see if it's making a difference, if it's harming, if it's helping. Sometimes it takes a while to figure that out.
But for now, whatever you're doing, just keep washing your hands.
Yes.
If you want to not get sick, wash your hands a lot. And finally, before we wrap it up, I just wanted to touch for a moment on shingles, because I find the public service announcements, the commercials for shingles are very effective in alerting you and alarming you about what you could be in for, and maybe you should seriously consider a shingles vaccine.
Certainly, the pharmaceutical companies do a great job
They do.
of marketing their
Yes.
product. And sometimes, you know, I can't help but think there's a little bit of fear-mongering in there for self-serving purposes. But it is a good vaccine. What's happened, though, is that the FDA, the Food and Drug Administration, actually approved the vaccine for use from the age 50 and older. However, the Advisory Committee on Immunization Practices, which is kind of like the gold standard that everybody looks to when it comes to vaccine practices, states that it shouldn't be given before age 60. And their reasoning for that is that as you get older, your chance of getting shingles increases.
Right.
So if you get it too early and they don't know for sure how long the vaccine is going to work, you could be into your 80s, and if you got the vaccine in your 50s, it may not be as effective as if you got it when you were in your 60s. So it makes a lot of sense logically.
But we know that if you had chickenpox, the shingles vaccine is inside you.
Yes.
And 1 in 3 people roughly will get shingles in their lifetime?
Yes.
If they've had the chickenpox, or maybe
Yes.
even if they haven't.
And, you know, it's not to say that the vaccine is going to 100% prevent you from getting shingles,
Right.
but what they do know is that it will certainly lessen the severity of the episode.
I'd be really angry if I got the vaccine and I still got the shingles. That would annoy me. But
Yeah.
it is possible. Nothing's
It is.
foolproof, right? Well, we learned a lot today, and I think we are healthier for it. I know I am because I got jabbed in the arm. But flu shot is a great thing, and I was even distracted by this toy. Susan Dubb, public health nurse from the Uncas Health District. Thank you so much for coming in today. We greatly appreciate it.
You're very welcome.
You can see this show and many others on our YouTube site. Until next time, I'm Sean Murphy. This is For the Record. Take care.